So this is going to be a very revision of the understanding which we have about the pediatric trauma. Whenever I am fully confident that all of you are expert about adult trauma, but children's bone are slightly different, and how they are different, let's understand that from the basic aspect. Yeah, so like the points which we are going to discuss in next 8 minutes are what are the forces which are acting on bones, how bone mechanically respond to these forces, and the most important thing is what is the difference between children and adults when this forces is applied on them. The force which are acting on the bones can be divided into 3 categories. The first force which is axial force, which is in the long axis of the bone, that could be working towards the bone, that's we call it compression force, like this. Or we have a force which is acting in the opposite direction, which we call it distraction force. So like a child when fall on an outstretched hand like this, the force which comes on that is a compressive force. And how the bones will respond to this force, let's see that. So suppose we see the bone as a 2 column, and on this 2 column the force is going to work, that's a compressive force. The mechanism which will take place, let's see that why the buccal fractures or the torus fractures they occur. Suppose one column is weaker than the other one. In that case, the one which I have shown in red is a weaker column, the other column is a stronger one, and when the force comes, the compressive force, the effect which will take place is something like this. So one column is broken. We see that in a practical sense when we see this type of fracture. Let's see that in a magnified view how this fracture takes place. The axial load comes, it's distributed on the dorsal and volar cortex, and one of the cortex is because it's weaker, that would fracture, and that results into the buccal fracture. So that's the mechanism of this simple fracture. Okay, now coming to the, so that's the buccal fracture. Coming to the next type of fractures which we also see in our practice, sometimes also in adults also. Suppose the force is much more in size or it's much more in the magnitude, then what happens? The force comes like this, and in that case the both columns will ultimately respond to the, or will fail to respond, and there is a fracture like this. The classic example nowadays which we see because of the videos or because of the movie, like they behave like this and they try to do almost the things like this and they result into this. So when they land on the ground, the forces which comes on that is either transmitted to the heel, to the foot, and they result into the multi-fragmented fracture of the calcaneum. And sometimes the force is transmitted in the elbow and we see a comminuted fracture of the supracondylar area. So that's because of the axial load. Now let's see how bone respond to the lateral force. When the force is coming from side, how it respond. If the force is coming from the lateral side, now if there is no restraint, what will happen? How the bone will respond? There is just a lateral shift of the bone. However, if the mechanism is slightly different, if one end of the bone is restricted or restrained, in that case the mechanism is something like that. The rate shows that that's blocking the one end of the bone, and when the force comes like this, so instead of simple displacement, now there is an angulation. And what we see more frequently in the practice is the next mechanism where the bone is restrained, like the child is sitting and there is a direct impact from the midshaft area. In that case, now the bone will have a problem, and that's, we call it a fracture. So usually when we see a lateral force acting and that resulting into the fracture, it's basically the bone ends are restrained at both ends. Now let's come to the mechanical response to the bone. This is more of a biomechanics, and we need to understand some of the mechanical part of that. Now first of all, like how the scientists, they study this part. There is a machine which is mainly used in engineering. That's a machine which measures when the force is given to the bone or any tissue, how much deflection or the deformation takes place. So it measures the amount of load and at the same time what is the deformation which is taking place in the bone. So let's see that how bone respond. This is both same for the children and adult. First of all, we will see how the children bone they respond to that. On the y-axis, we have a stress, that's the amount of force working on the bone. On the x-axis, we have a strain, that's the deformation which is take place on the in the bone. Suppose this is the amount of stress which is given to the bone, and there is this much is a deflection. So ultimately, if we plot that on a graph, this is a point. If we take a slightly more load, there is a more deformation. So again, if we put that on the load, this is a point. Similarly, if we do it for a more and more load, for the third load and for the fourth load. Now, if you see, this behaves in a straight line. Something like this. But after certain load, the things change. Till now, the bone was coming to the original shape. But now with a slightly higher load, when the load is applied, there is a deformation. And if we put that on a graph, it's not in a straight line. It is slightly deviated. So, and when we take out the load, the bone doesn't come to the original state. If we apply more load, again, the same thing happens. And now, if we draw a line, then this is where it was coming to the original shape. That is known as the elastic area. When it is not coming to the original shape, that's known as a plastic zone. So this is a plastic zone. And after that, if we applied further load, then bone has a likely to give way. That's we call it a fracture. So that's the next zone. So initially elastic load, later on there is a plastic deformation, and ultimately failure, that's a fracture. So now let's see how children bones or the child's bone is different than that of adult. We saw this graph. Now if we draw a similar graph for adult, then it responds differently. If we draw a same type of graph for the adult bone, it's a dotted line which is seen. Now what is a repercussion or what is the effect of that? If we look at the stress, for a similar amount of the stress, if we compare child versus adult, in that case, if you see, the deformation is much more in case of children. So for a same amount of load, the deformation is much more. And the second point, if we look at on the stress, the children bone, they remain in the elastic range for a higher load compared to that of adult. So this is what the graph for the adult, the dotted line. Now what is the practical significance? The children's bone are more elastic, but the question is why they are more elastic. I really tried to search this and I couldn't find out the actual reason. One of the theory is that the Hervatian system, which is a canal in the bone, is larger compared to that of an adult. So there is a less calcified material and a more empty space, and that's probably the reason that children's bone are more elastic. Now what is the effect which we see clinically? Compared to adult, they are less likely to have a fracture for the same amount of load. The one effect which we see in ribs because of its sheath structure is anyway it's more elastic, but because the child's rib is further elastic because of the quality, it's very less likely to rupture. So in a case of children, we will see that we rarely see a rib fracture. In adult it's very common, but in children it's not very common because of this property. And the another effect is the lungs injury is much more common in children compared to adult, because rib can deform, can cause lung injury, but it's not seen on X-ray as a rib fracture. Another special type of fracture which we see in children is a plastic deformation. They don't break, but there is just a deformation. So that's one typical picture which we see in children. And the third variety of fracture is a greenstick fracture. Now actually greenstick fracture is a combination. The inner side, when the force is coming, the inner side has a plastic deformation. One cortex has a plastic deformation. The other cortex has a fracture. So that's a greenstick fracture, which is very common in children, but that's not seen in adult. So the take-home message of this talk is the children's bone have a more elasticity compared to adult, and due to that, a buccal fracture, plastic deformation, and greenstick fractures are typical of children's fracture. Thank you.